Ma'am, can I place my things here? Okay, thank you. Alright. Ma'am, I am Janiza Lipura. I am your nurse for today. May I have your name, please?
My name is Angel. Angel Mary Pura.
Okay, can I have your birthday?
My birthday is 6th of May 2006.
Alright, thank you. So again, I am Jen. I am your nurse for today. And for today, we will be doing a physical health examination, okay? So we will be assessing your skin, hair, nails, ears, and eyes. Also with your head and neck, mouth, throat, nose, and sinuses, okay? This will help us, what you call this, diagnose you better. Also to make a better care plan for you, okay? Alright, so I'm gonna wash my hands first and then I'll get back to you, okay? Okay, after washing the hands and observe appropriate infection control procedures, you can already go back to the client's room and then provide for client privacy. In providing client privacy, you can close the curtains, make sure that only the client is in the room, and also close the doors. Okay, now let us proceed in assessing the um, skin and nails. Okay, first inspect the uniformity of the skin. For this one, you need to take note of the color, moisture, texture, and skin variations. Always remember to ask permission to the client if you're gonna touch her or him, because there are different cultures that doesn't want to be touched. Okay, so ma'am, I'll be touching your skin. So again, check the uniformity of the skin, and then also um, yeah, try to check onto the skin. So try to check if there are any skin lesions or any primary, secondary, or vascular lesions. And then you can use your ruler the um, in measuring the size of the lesions, and then always make sure to check on the characteristics. Also palpate the skin temperature. In doing so, use your dorsal surface of your hand or the back of your hand in getting the temperature. Okay, so ma'am, I'll be checking your temperature. So try to see the coolness or the warmness of the client's skin. Okay, third is to assess edema if present. If your client has problems with their heart or with their kidneys, there's a possibility that there is an edema. So in assessing that, you need to use your thumb to press down the skin of the feet and the ankles. So my client doesn't have that one, so I will not be doing this assessment. For number four, take note of the skin's mobility and turgor. Hopefully you'd know what's the difference between the two. So on this one, you need to ask the client to lie down, gently pinch the skin over the clavicle to check the mobility and turgor. So with this one, we will not be asking the client to lie down. And then some of the clients may be ticklish, so inform ahead of time that you will be pinching the clavicle. Okay? So ma'am, let me pinch your clavicle. So again, gently pinch the bony prominence of the clavicle and then release. So mobility is by the time you're able to pinch it, and then turgor is the one in which it goes back right away after being pinched. Okay. Next is to inspect the cleanliness, grooming, shape, nail color, and markings of the nails. So with this, normally the nails are 160-degree angle between the nail base and the skin. So you need to check on that one on the client. So try to see if it is clean, if it has any markings. Also palpate the texture, consistency, and the capillary refill time. So you would see or check if the client are having use line, the early and late clubbing. Okay, with the palpation, especially in getting the CRT, you need to press the nail bed and then try to check if the color goes back immediately. Okay, so again pinch and then release. So So check it with all the nails. Also with the other hand. Okay, let us proceed now in assessing the skull, hair, and face. So first, inspect the skull for size, shape, and symmetry. So check on any involuntary movements of the head. So try to check. So then we need to palpate the skull for nodules or masses and depressions. With this one, we need to wear some clean gloves in order to protect ourselves if the client may have any infestation or drainage. Okay, I have my gloves on. So ask the client, tell the client that you will be palpating his or her head. And then if the client has any hair ties or hair clips, try to ask the client to remove it first, okay? Now I'll be palpating your skull. So try to feel if there are any nodules or there are any depressions. Also try to um, palpate under the at the back of the ear and also the back part of the hair. Okay, so that's it. Next is to inspect the evenness on growth of hair over the scalp and inspect the hair for thickness or thinness and hair oiliness. So you need to check the status of the hair to see if there are any folliculitis, any alopecia, or any problems with the hair. Okay. Next is to note the presence of the infection or infestation by parting the hair in several areas and checking behind the ears and along the hairline at the neck. So at 1 inch interval, you need to separate the hair and scalp using the comb. Okay. Okay, ma'am, let me just check your hair. So again, 1 inch interval and then separate it to fully visualize the client's um, hair. So try to see if there are any excessive oiliness, any dandruff, or any infestations. Okay. Um, all right. Before we inspect the facial features of the client, you need to add this up into your procedure guide. You need to palpate the temporal artery of the client and the temporomandibular joint. So you can already remove these gloves. So this is how you palpate the temporal artery. It's between your eyes and your temples. So try to feel the characteristic of the artery and also its elasticity, or if the client any may have experienced any pain or tenderness on that area. Okay. To add it up, you need to palpate for the temporomandibular joint. Use your index finger over the front of each ear as you ask the client to open the mouth. Okay, so in front of, place your index finger in front of your ear, of the client's ear, and ask the client to open his or her mouth. Okay, can you open your mouth, ma'am? Close, open, and close. Okay, so try to see if the client opens his or her mouth, there should be an indentation on that part into the temporomandibular joint. Also, try to see if there are any crepitus upon opening or closing his or her mouth. Okay, now we need to inspect the facial features of the client. Ask the client to smile, frown, or puff his or her cheeks. Also note the symmetry of the facial movements. Okay, ma'am, can you smile, then frown, and then puff your cheek? Okay, so the client was able to with um, do that smoothly. Um, with the symmetry of the facial movements, take note that the nasolabial folds here and the palpebral fissures are ideal places to check for facial features for symmetry. Okay, let's continue with the assessing the eye structures and visual acuity. So first, inspect the eyebrows for hair distribution and alignment, for skin quality and movement. You also need to inspect the eyelashes for evenness and growth, distribution, and the direction of the curl. Okay, so eyebrows are symmetric, and then here are finely distributed. For the eyelashes, it is curled outward. Okay, next is to inspect the eyes for edema and hollowness. So you need to check this part of the client's eye to check if there is hollowness or any puffiness. Fourth is to inspect the eyelids for surface characteristics, ability to blink, and frequency of blinking. Inspect the lower eyelids while the client's eyes are actually closed. Okay, so you need to ask the client to close her eyes and try to check on it. Okay, ma'am, can you close your eyes? Okay, while the client is closing her eyes, try to check the eyelids, the upper eyelids of the client, and try to check if the eyelids are completely closed. Okay, because failure of completely closing the lids, the client may have at risk of the corneal damage. Okay, you can now open your eyes. Okay, next is to inspect the bulbar conjunctiva. This one, try to check the color, texture, and the presence of lesions. So ask the client here in checking the bulbar conjunctiva, while the head is straight, ask the client to look from side to side and then up towards the ceiling. Okay, you can also do this with inspecting the palpebral conjunctiva by everting the lids. So let's have first the bulbar conjunctiva. So ma'am, with your head straight, can you look side to side and then up the ceiling? Alright, good. Now with the palpebral conjunctiva, you can only do this one, or yeah, you can only assess this only if the client complains of pain or complains of there is something in the eye. So place your thumbs bilaterally at the level of the lower bony orbital rim and gently pull down to expose the palpebral conjunctiva and ask the client to look up. So invert this one with a bowing prominence, and then ma'am, kindly look up. So try to see the bulbar conjunctiva, it is pinkish, or if the client has a pale palpebral conjunctiva. So there's also again another way in inspecting the upper palpebral conjunctiva, that's everting your upper eyelids. So you may have done this one during your childhood with your siblings or with your classmates, but it's a bit uncomfortable, so I will not be doing that assessment. Okay, next is to inspect and palpate the lacrimal glands, lacrimal sac, and nasolacrimal duct. In doing so, you need to use one finger in palpating and also palpate just inside the lower orbital rim. So in assessing that one, you need to use just your index finger. So here is your lacrimal gland here. So try to ask the client if there is any pain or tenderness, and try to see if there are any discharges in the lacrimal duct upon palpation. there any pain, ma'am? Okay, so this is the lacrimal gland. This is where it is located. Here is the lacrimal duct. So try to check. And this is the nasolacrimal duct. Any pain, ma'am? Okay. Next is to inspect the cornea for clarity and texture. Now to do this, we need to shine a light from the side of the eye for an oblique view. So look through the pupils to look into the lens. So we need to have the pen light for this. Ma'am, can you stare at the wall behind me? And then I'll check the lenses of your eyes. Okay? Can we do that, please? Okay, again, shine a light obliquely at the side. And then try to check onto the lenses. Okay, also do that onto the other side. Okay. Next is to perform the corneal light reflex and the corneal blink reflex. For the corneal light reflex, this is to test the parallel alignment of the eyes. So these are the instructions or the guidelines you need to do. For corneal light reflex, hold a pen light approximately 12 inches from the client's face. Shine the light towards the bridge of the nose while the client stares straight ahead, and take note of the light that is reflected on the corneas. So take note that the normal finding for this is that the reflection of light on the corneas should be in the exact same spot onto each eye. So let me just darken the room. In that way we can appreciate this corneal light reflex. Okay. Okay, again, shine a light 12 inches away from the client, and then instruct the client to stare straight, or stare at the back, or stare somewhere. Okay, then light the pen light. Ma'am, can you stare there? Now I'll be lighting something to your eyes. Okay. Okay. So that's 12 inches, and then try to see the reflection of light on each eye, so it should be on the same spot as the other eye. So in that case, you would actually know if the client may have any problems with the eye, like strabismus or the ectropion or ectropion or entropion. So next is the corneal blink reflex. So we will be using the cotton ball for this. For this, you need to make a wick out of it. Simply just get a portion of the cotton ball and then make twist it. Okay. So approach the client's eye on the side and check if the client blinks by the time the cotton touches his or her eyes. Ma'am, can you look straight ahead, then approach it like this, and then also on the other side. Okay, so there is a positive corneal blink reflex. Now let's proceed to the 10th step. It is to inspect the pupils for color, shape, and symmetry of size. So also do this inspection into the iris. Try to check if the client has the same size, or they have the same size with each other. For the pupils, again, normally it is 3 to 5 millimeters. And try to check what is the color of the client's iris as well. Next is to assess the pupil's direct and consensual reaction to light. So with this one, you need to darken the room and ask the client to focus on a distant object. So this goes with each, or this two assessment goes with one another. So for the direct reaction to light, shine a light obliquely in one eye and left and observe the pupillary reaction. With the consensual, by shining a light obliquely into one eye, you need to observe the pupillary reaction into the opposite eye. So when I'm doing this, let's say I am assessing the client's left eye, I am doing the direct reaction to light here. The consensual happens onto the opposite eye. So by the time the light passes through the left eye and the pupils will constrict, it should be that the right eye should also, or the pupils of the right eye should also constrict, even if it's not shined by the light. Okay, so let's do that one by darkening the room first. To use an opaque card for this, in that way you can cover the other side of the client's eye. Okay, so yes. Okay, and it is also important to give instructions to the client. Okay, ma'am, I will be assessing your pupil's direct and consensual reaction to light. So I need you to cover your other eye first. Do this. Do this. Alright, then you start your, what you call this, direct and consensual reaction to light. So shine a light here. Try to check the constriction or the pupils. If it has constricted, then try to see on the other side if the pupils have also constricted. Okay, then do it as well into the other eye. Okay, so that's it. Okay, next is to assess the pupil's reaction to light and accommodation. Okay, for this one, you need to hold your pen light about 12 to 15 inches from the client. Ask the client to focus on your finger or pencil and to remain focused on it as you move it closer in towards the eye. So we have already done the pupil's reaction to light when we did the direct and consensual reaction to light. Now with the accommodation, ask the client to, or give instructions to the client on what to do, okay? So, okay, ma'am, I have a pen light here and I need you to focus on this and then try to follow the pen light, okay? Because I'll be moving it, okay? Again, 12 to 15 inches away from the client. Okay, here it goes, ma'am. Okay, so the client was able to do it smoothly. Try to see if there are any shaking of the iris or with the pupils or with the eyes, and also try to see if there is convergence on both eyes by the time you place it or you have moved it towards the nose, because we need to check if there are any strabismus, if the one other eye was able to converge and the other eye was able to still see you directly. Okay, next is to assess the peripheral visual fields. Now this visual fields for gross peripheral vision is what we call the confrontation test. Again, this is the confrontation test. We need to position ourselves approximately 2 feet away from the client at eye level. Have the client cover her left eye while you cover your right eye. Look directly at each other with your uncovered eye. Extend your finger on the 4 quadrants. We have the inferior, superior, nasal, and temporal, and let the client identify what number did you present on your finger. So please make sure to follow those guidelines in doing the confrontation test. And you may need to ask the client, or you may need to use the opaque card for this one as well. And please make sure to give instructions to the client, okay? I am already 2 feet away from the client. Okay. And then ask the client or inform the client about the procedure. Okay, ma'am, we will be doing the confrontation test to check the your peripheral visual field. Okay, so I need you to cover your, we'll be assessing first your right eye, so I need you to cover your left eye and I'll be covering my right eye. So I need you to look me into the what do you call this, uncovered eye. Okay, and then I'll be presenting something on my eye here, I mean on my hands here. Tell me what are the numbers that you can see. Okay, here. Okay, kindly cover your left eye first. I'll be covering my left eye. Okay, just look into me and then tell me what number am I presenting. Okay,
2, 1, 3, 3,
okay, good. Next, the other eye, please. Okay,
5, 2, 1, 3.
okay, that's it. Thank you. Okay, now let's move on with our um, second to the last step. It is to assess the 6 ocular movements to determine eye alignment and coordination. This is to assess the eye muscle strength and also the cranial nerve function of the eye. This is what we call the positions test. In this one, we need to instruct the client to focus on the pen light. It should be 12 inches away from the client, and then move the object through the 6 cardinal gazes in a clockwise direction and observe the client's eye movement. So we should take note of the movement of the eye if it was able to follow the 6 cardinal movement that you did. Okay. So for this, I'll be just using my pen light for the client to follow through. Okay. Again, give instructions to the client. Ma'am, I'll be doing the positions test, and then I have a pen light here. I need you to follow this one. Okay. Okay, so again, 12 inches away from the client, and then after giving instructions, you can already do the position test again in clockwise direction. Okay. Follow this one, please. Okay, that's how you do the positions test. And then it is actually important to give instruction to the client not to move the head. Only the eye should move while he or she will follow the object that you're trying to move for the 6 cardinal movements.
Instruction ng yata natin.
Okay. Alright, and then our last step for assessing the eye is to assess the distance vision. Now, this is what we call the distant visual acuity test. So for this one, we need to position the client 20 feet from the Snellen chart. Ask the client to use an opaque card, we have the index card or A1 paper, to cover one eye, and let her read each line until she cannot decipher the letters or their direction, and then make sure to document the results. It is also important to really assess each of the eye. Okay, so we're gonna use the Snellen chart or an E-chart for this one. So we have the Snellen chart there, and then I need you to read from the first letter, or from the topmost letter up until the letter that you can decipher. Okay, and then I need you to as well close your other eye or cover your other eye so that we can assess each of your eye. Okay, so kindly close your eyes as well, then cover.
E, F, T, E, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, D, P, F, E, L, O, P, Z, D, D, E, F, P, T, F, P, D, O, Z, L, P, E, D, P, E, C, F, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, P, E, F, P, O, P, E, C.
Okay, let's proceed in assessing the ears and hearing. So first, make sure to position the client comfortably seated if possible. And then inspect the auricles for color, symmetry of size and position. Also, you can palpate the auricles for texture, elasticity, and areas of tenderness. Okay, so let's do that, ma'am. I will be assessing your ears now. May I ask you to remove your earrings, please? Okay. After that, you can inspect the ears of the client, its size, if it is symmetric to both, and then palpate the auricles. So try to see if you can find any tophi or tophi or any, if there is any tenderness or pain upon palpation. Is it painful? After that, you can also palpate the tragus and the mastoid process. So again, this is the tragus, okay? Try to press it and ask the client if there is any pain. Is there any pain? And then also the mastoid process, that is the bony prominence at the back of the client's ear. So here. Is there any pain? Next is to inspect the external canal for cerumen, skin lesions, pus, and blood. Okay, together with that, we need to inspect the tympanic membrane for color and gloss. Okay, so you need to have your pen light with you, and then with my pen light, it actually comes with a speculum, so I can really see the um, external ear and also view the tympanic membrane or the eardrums. So remember, if you can see the tympanic membrane or the eardrums, or to check the, or to straighten the um, ear canal, you need to, for adults or for ages 3 up, you need to pull out the ears up and then back. Again, up and back. But if it is less than 3 years old, that's down and back. Okay, so since my client is more than 3 years old, so you need to, again, up and then back. That will straighten the ear canal. So I will do that. For the tympanic membrane, for the cone-shaped reflection, that's 5 o'clock onto the right ear and then 7 o'clock onto the left ear. So now I'll be checking your ears. Just for a moment. Then up and back. And then insert the speculum and then try to check the situation of the ear. And then do that one as well onto the other ear. Always remember that with a tympanic membrane, its normal situation is it's pearly gray, translucent, and shiny. Okay, now let's proceed with our next step. It is to assess the client's hearing acuity using the following tests. So in your procedure guide, you can see there watch tick test, Weber's test, and Rhine's test. Now with instead of doing the watch tick test, we will be utilizing the whisper test. Okay, in doing so, we need to ask the client to gently occlude the ear not being tested and rub the tragus with a finger in a circular motion. Then you can start testing the better ear, then the poor ear. Now with your head 2 feet behind the client, whisper a 2-syllable word and ask the client to repeat it back to you. Okay? Then the client should identify 3 out of 6 whispered words to be considered for her to be considered passed on the whisper test. So again, before the client will turn her or his back on you, give proper instructions, okay? And always don't forget to assess one ear at a time, okay? Okay, ma'am, for today I will be Okay, ma'am, for now, we will be doing the whisper test. So I need you to turn around and then I will ask you, I need you to like occlude your one ear. So I'll start with your assessing your left ear first, okay? So I need you to cover your right ear, press the tragus, this one, and then occlude this one and then do a circular motion, okay? I will be whispering to you some words and I need you to identify or tell me what are the words that I have whispered. Okay? Is that clear? Okay, so I need you to So for this one, I will be assessing first her right. So for this one, I will be assessing her left ear first. Need to change to the right ear. Yeah, okay, so let's have the whisper test. So if we will be start doing okay, so let's have the whisper test now. Since I will be assessing first her left ear, I should be 2 feet away and I should be directly into, whisper directly into the left ear. Okay? So, ma'am, can you occlude now your right ear and then do a circular motion onto your right ear? I'll be whispering now your words and kindly repeat the words that I have said, okay? Okay. So after assessing the left ear, do the same thing on the right ear. Okay, ma'am, can you now occlude your left ear and then do the same thing, circular motion, and then I'll be whispering some words again. Okay. Okay, so my client was able to repeat every word that I've said. It is also important if the client wasn't able to repeat what you have said, you need to repeat that word again. Okay? Next is to do the Weber's test. Now, in doing the Weber's test, we need to use the tuning fork. Okay? So, okay, so this is the tuning fork. Now, this Weber's test is performed if the client reports diminished or lost hearing in one ear. So, in order for you to assess or to do the Weber's test, you need to strike this tuning fork softly with the back of your hand or anything or any metal thing that you can strike it on, and place it at the center of the client's head or the forehead of the client. Ask and then ask whether the client hears the sound better in one ear or the same in both ears. Okay? Again, it's important to give instructions to the client. Ma'am, this is a tuning fork and we will be assessing your hearing acuity. So this is what we call the Weber's test. I'll be placing this one later on your head. So I need you to try to listen into the vibration and then try to see if you can hear it on either one side of your ear or both sides of your ear. Okay? Do that. Okay, were you able to hear it
both sides.
on both sides? Okay, good. Next is to do the Rhine or the Rhines test. Okay, so with this one, this compares air and bone conduction sounds. So again, we'll be using the tuning fork. So again, strike a tuning fork and place the base of the fork on the client's mastoid process. Again, mastoid process is at the back, the bony prominence at the back of your ears. Then ask the client to tell you when the sound is no longer heard. Then by the time the client says it's no longer heard, move the prongs here or this one. Move the prongs of the tuning fork to the front of the external auditory canal and ask the client if the sound is audible after the fork is moved. Okay, again, give instructions to the client. We will be doing the rhymes test, and then I will be still using the tuning fork. I'll be placing first here in your mastoid process, and then you may hear the sound. Um, by the time you can no longer hear the sound of the tuning fork, let me know. In that way, I can switch it on here onto your external auditory canal. Okay? All right. So also do that one into the other ear. Okay? So normally, the normal finding for the Rhine test is the air conduction is greater than the bone conduction. It means that it has longer time period when you place the prongs into the external auditory canal than the um, tuning fork, which is placed on the base of the mastoid process. Okay, so that's it for the assessing the ears and the assessment of the ears and hearing. So let's proceed now with the assessment of the nose and sinuses. Now first, inspect the external nose for any deviations in shape, size, or color, and flaring or discharges from the nares. Okay, so let's do that. So try to see the nose, and then next one is to lightly palpate the external nose to determine any areas of tenderness, masses, and displacement of bones and cartilage. Okay, so ma'am, I'll be touching your nose. Okay, let me know if it is painful or if it is tender. Okay. Okay. After that, um, next step is to determine the patency of both nasal cavities. So let the client occlude one nostril at a time and ask her to sniff. Now there are two methods in doing this. The one I've mentioned earlier, and then the other one is to use a handheld mirror and then let the client sniff on that mirror and check if there is any mist. Okay, so let's do both. So ma'am, kindly occlude one of your nostril and then try to sniff out. Okay, can you do that? Okay, the other side please. Okay. Now let's have the instruction or the step in which you will be using the mirror. Okay. Ma'am, I need you to occlude again one nostril, and then onto the uncovered nostril, I need you to, I'll be placing this, then I need you to sniff, okay? Kindly include one of your nostril first. Okay, try to sniff. Okay. If you can see, there is a mist onto the mirror, so there is no blockage while sniffing. Okay, do it on the other side, please. Okay, there is still a mist. Okay, next step is to inspect the nasal septum and nasal cavities using a pen light or a nasal speculum and observe for the presence of redness, swelling, growths, and discharges. So if you don't have any nasal speculum, you can still use the pen light, and then in the visualization of the nostrils or the nasal septum, hold the tip of the nose slightly up. In that way, you can fully visualize it. Okay. So, ma'am, can you tilt your head? Then again, what you call this? Hold the tip of the nose slightly up, like this, and then flash your pen light and check. Okay, that's it. And then last last step in assessing the nose and sinuses is to palpate the maxillary and frontal sinuses for tenderness. Now, in palpating your frontal and maxillary sinuses, you need to use your thumb in doing so. So, for the landmarks for the frontal, you need to palpate the bony prominence above the eyebrows, and then for the maxillary, you need to palpate the bones within the cheek. Okay, so ma'am, I'll be touching your what you call this your face. I'll be assessing your sinuses. Let me know if there is any tenderness or pain upon palpation. Okay, so let's start first with the frontal. So try again, use your thumb and then try to palpate do the light palpation and then press into here above the eyebrows. Is there any pain, ma'am? Okay, after the frontal, try to assess the maxillary. Is there any pain? Okay, so that's how you do the palpation. Now, if the client is experiencing pain or tenderness, you can proceed with the percussion of the sinuses. All you just need to do is use your fingertips and then tap. So, do this one. Is it painful? And then on the other side, for the frontal, also for the maxillary. Okay, so for the frontal sinuses, hold a strong light or a narrow light source snugly under the eyebrows. And then for the maxillary, hold a strong and narrow light source snugly into the maxillary sinus and ask the client to open her mouth. So we will be doing it now. So ma'am, I will be shining a light into your eyebrows and also into your cheekbone. And then I need you to just follow my instructions, okay? Okay, under the eyebrows. So do this one. Okay, if you can see it on your end, there is actually a red glow there, right? So slightly move it here. Okay, and then on the other side. So there is a red glow, so this is a normal frontal sinus. Okay, now let's assess the maxillary. For this one, we need to go to the place the light into the maxillary sinus and let the client open her mouth. So we need to check if there is a red glow into the hard palate. Okay, now I'll be pressing this one here, and then I need you to open your mouth. Okay, so here, and then try to press it lightly and then ask the client to open his or her mouth. Can we open your mouth, ma'am? Okay, the other side. You may not be able to see it there on your end, but try to do this one on your end. Okay, and open your mouth. Okay, there is actually also a red glow for that. Okay, let us proceed now with the assessment of the mouth and the oropharynx. Now, before doing anything, you need to pre-open your sterile glove. Okay, so we are gonna proceed with assessing the mouth and oropharynx. Before you do the assessment, you need to pre-open the sterile gloves, gauze, and the tongue depressor because you need to verify or you need to have a clean hand and a sterile hand. Okay, so yes, go. Okay, after pre-opening your um, after pre-opening your sterile gauze, your tongue depressor, and also when you have already done your gloving, you can already proceed now with your the assessment of the mouth and the oropharynx. Now you need to make sure to determine which of your hand is clean and which of your hand is sterile. Now for the clean hand, this is used to what you call this you need to use this one in holding the pen light, and then this sterile hand is used to hold the sterile gauze and also the tongue depressor. Okay, so what I usually do, non-sterile hand or the clean hand is my left hand, and then my dominant hand is right, so this I'm using this one for the sterile um, materials. Okay, so let's start. Inspect the outer lips for symmetry of contour, color, and texture. And then inspect and palpate the inner lips and buccal mucosa for color, moisture, texture, and presence of lesions. Okay, so you may need to do that one into your time. Ma'am, I'll be assessing now your mouth and your oropharynx. So I'll need to like palpate it and inspect it. I need you to open your mouth. Okay, now let's start with the lips. So try to palpate the lips and try to see if there are any lesions, any fissures, chapped lips. Also try to check on the color of the lips. Okay, now can you open your mouth, ma'am? Okay, and then try to lift the client's head to check, and then you can close your mouth now. You can use your pen light in checking on that one. Okay, so together with that, you can also inspect the teeth and gums while examining the inner lips and the buccal mucosa. So yeah, try to check as well with the salivary glands, especially the Stenson's and also the Wharton's gland. Okay. So I'm using my sterile hand to get the tongue depressor. This can also be used in really checking what is on the in the mouth of the client. Okay, can you open your mouth, ma'am? I'll be checking. Kindly lift your head a bit. Okay. So try to see the buccal mucosa. Try to count the teeth. Try to see if there are any decays, and try to see if there are any cosmetics such as braces, veneers. If the client has dentures, kindly ask them to remove that one. Okay. So you need to palpate now the tongue and floor of the mouth for any nodules, lumps, or any excoriated areas. So we need to use here your your sterile gauze. Okay. So for this tongue depressor, just place it back in which there is the sterile field of the gauze. Okay, again, give instructions to the client or ask permission that you will be using your gauze. In palpating the what do you call this? The tongue. Okay, ma'am, this is a gauze. It might um, taste like funny, but um, we'll use this one in checking your tongue. Okay, so kindly open your mouth and then tongue out, please. Okay, so hold the tongue. Try to feel and palpate if there are any nodules or any excoriated areas, and then try to pull it on the side and try to see if there are any um, nodules or anything abnormal. Okay. And then that's it, and then discard this gauze. Next is to inspect the salivary ducts openings for any swelling or redness. We have already checked that one earlier with the Stenson's and the Wharton's ducts. And then inspect the uvula for positioning and mobility while examining the palates. So we need to check the soft and the hard palate. And then ask the client to say ah to check the uvula. Also, together with that, inspect the oropharynx for color and texture and tonsils for color and discharges and size. So you need to grade your tonsils. Okay, ma'am, I'll be checking your uvula, the bell structure that you can see at the back of your throat. I need you to say ah, and then I'll be checking as well your tonsils, okay? Can you open your mouth, please, and say ah?
Ah. Ah.
Okay. And then try to check on the tonsils. So it is 1 plus, in which the tonsils are just visible on the side. Okay, now we can elicit the gag reflex by pressing the posterior tongue with a tongue depressor. Okay, ma'am, this might be a bit uncomfortable. I'll be eliciting your gag reflex. So let's check on that one. Can you open your mouth, please? Okay, that's a good gag reflex. Then kindly add this one into your procedure guide. We will be adding the what do you call this, the taste test to check on the taste buds of the client. So for the taste test, you can already remove your gloves here. For the taste test, I have prepared 2 condiments. It's one is sugar and one is salt. So you need to make sure that you have 2 separate canisters for those, and each should have different spoons. So make sure you can actually use the disposable spoons and also the what do you call this, cups for this one. So make sure that the client was not able to see it. In that way, you would really gauge the ability of the client's tongue for taste. Okay, but for also make sure that you have some water with you. In that way, the client will wash out um, the previous food or condiment that you have let her taste. Okay, so give instructions to the client for this one. Okay, ma'am, we will have a taste test. So I will be giving you something to taste. So I need you to close your eyes and then I'll just give you instructions to open your mouth and then let me know what can you taste. Okay? Alright, kindly close your eyes now and then kindly open your mouth. Okay, close. your eyes, and then what is the taste?
It's sweet.
It is sweet. Okay. Then I have another one here, so just drink first so that can be washed out. Okay, this will be another what do you call this? Something to taste. Okay, kindly close your eyes now, then open your mouth. Okay, you can open your eyes now. Can you tell me what's the taste?
It's salty.
It is salty. Okay, thank you. And then here's some water. Okay, after doing so, you can also have this one. We need to as well, what you call this, assess the tongue strength. So you can try to do this. Um, Place your fingers on the external surface of the client's cheek. Then ask the client to press the tongue's tip against the inside of the cheek to resist pressure from your fingers. Okay. Now, ma'am, I will be placing my what do you call this finger here. Kindly use your tongue to push it. Okay. The other side, please. Okay, good. All right. So that ends our assessment of the mouth and oropharynx. Let us proceed now with our last assessment, which is assessing the neck. Okay. Okay, first we need to inspect the neck muscles and observe the client's head movement. Then we need to shine a light from the side of the neck across to highlight any swelling. Also ask the client to sip water and observe the movement of the thyroid cartilage and gland, and inspect the cervical vertebrae by asking the client to flex the neck and do the chin to chest to check on the vertebrae prominence or the C7. Okay, so again, try to check on the neck muscles. Okay, let the client sit straight. Then use the pen light and shine the side of the neck. Then try to see if you can figure out if there is any enlargement of the neck. The other side. Okay, ask the client to sip some water and try to see the thyroid cartilage. Okay, ma'am, can you sip some water? And then hold it first. Okay, thank you. And then to check the C7 or the vertebrae prominence, ask the client to flex the neck again, chin to chest, like do this, and then give instructions and then palpate the C7. Okay, ma'am, let's, can you do the chin to chest? Do that one. I'll be checking your C7. Okay, so, kindly try to fix that. Okay, then palpate the back of the neck of the client. This is actually the C7 here, or the vertebrae prominence or vertebra prominence. Okay, next is to assess the muscle strength of the client. So it is the range of motion of the neck. So ask the client to turn their head from right and to the left. Turn their head to right and to the left, which is chin to shoulder. Then touch each ear to the shoulder. Then touch chin to chest, and then lift from your chin to the ceiling. So give instructions to the client for this. Okay? Okay, ma'am, I'll be checking the range of motion of your neck. Okay? So kindly do the chin to shoulder. Just follow me. Okay? So do this. And the other side, please. Okay? Then chin to, ear to shoulder. So do this. and then the other side. Then do the chin to chest. Do this, okay, and then chin to ceiling. Okay, any problems in doing the range of motion? Okay, none. Thank you. And then next step is to palpate the entire neck for the enlarged lymph nodes. So make sure that you know what are the lymph nodes that you will be palpating. Okay. So just to review, we have the preauricular, postauricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical, and supraclavicular. So make sure that you know where is the location of each lymph nodes, and since you will be touching the client, ask permission again, and there might be at times that the client may be ticklish, so give a heads up for that client. Okay, so hey ma'am, I'll be palpating your lymph nodes into your neck, so it might be ticklish, let me know, and that way we can manage. Okay, so let us now palpate the lymph nodes of the client. Okay, so let's start with the preauricular. So again, use the 2 to 3 finger pads of your hand. So preauricular. Then we have the postauricular. Next is occipital here. Then also ask the client if there is any pain or tenderness. Okay, is there any pain, ma'am? Okay, after the occipital, we have the tonsillar here. Then we have the submandibular in between the tonsillar and the submental. Then we have the submental here. Next, we're going down. So we have the we need to find the sternomastoid muscle. Okay, so it's here. It's like a V-shaped muscle. So we will be utilizing that one to locate the cervical lymph nodes. Okay, so let's start with the superficial cervical. Then we have the posterior cervical here. Okay, it might be ticklish, ma'am. Let me know. And then we have the deep cervical here. And then the last one is the supraclavicular. That's above the clavicle bone. Okay, so that's all the lymph nodes in the neck. Okay, next is to palpate the trachea for lateral deviations. So you need to place your finger on the sternal notch, feel each side of the notch, and palpate the tracheal ring. So this is an anterior approach. Okay. Ma'am, I'll be palpating this part of your neck. I will be checking your trachea. Okay, so do this one. Try to feel the tracheal rings. Is there any pain, ma'am? Okay, that's it. And then the last step for this assessment is to inspect the thyroid glands and palpate afterwards for smoothness and note for any enlargement. So for this, use the posterior approach. So you should be at the back of the client for this. And then palpate the thyroid. In doing so, kindly listen to my instruction. Stand behind the client. Okay, again, stand behind the client. Ask the client to lower the chin to chest and turn the neck slightly to the right. This will relax the neck muscles. Okay, then place your thumbs on the nape of the client with the other fingers on either side of the trachea below the cricoid cartilage. Use the left fingers to push the trachea to the right. Then use the right fingers to feel deeply in front of the sternomastoid muscle. Ask the client to swallow as you palpate the right side of the gland, and then you do the reverse technique for the neck, for the left side. Okay, so before the client will turn, or before you ask the client to turn, give instructions first. Okay. Okay, ma'am, I'll be palpating your thyroid gland, so I need you to turn around later. I'll be giving you instructions and then kindly follow. Okay? Alright, can you turn your back now? Okay. Okay, ma'am, can you do a chin to chest? Lower your neck, please. And then move your neck slightly to the right. Okay, good. So again, use your left hand in what you call this, to push the trachea to the right, and then use your right fingers to palpate the right side of your thyroid. Then ask the client to swallow. Ma'am, can you try to swallow? Okay. So try to see if there are any nodules or any enlargement. Okay, let's do the other side, ma'am. Again, chin to chest, and then move your neck slightly on the left. Okay. Again, for now, use your right in pushing it to the left side. Use your left now in palpating. Ma'am, kindly try to swallow. Okay. Okay, that's alright, so that's the end of our skin, hair, nails, ears, and eyes assessment, also with the head and neck, nose, sinuses, mouth, and throat assessment. So after the assessment, I would suggest that after every system, you need to take note of your findings, okay? And then after everything, after all the assessment, inform the client what you've got, what are the normal findings, what are the abnormal findings, and the health teachings that you can give in order for them to normalize or to manage those abnormal findings, okay? And then also do aftercare, and then also thank the client for the cooperation. Then document everything. If it needs to be on the chart, document what are the findings you've got during the assessment. And that's everything for our orally 1F return demonstration for your video assignment. Hopefully you have learned something from this demonstration, and thank you for watching.